Are you going for a walk every day? Is any of your doctors tell you that you have to go for a regular walk to control your blood pressure or to bring down your blood sugar levels? If so, are you doing the walking right? Are you exercising your heart enough? And how do you see you're progressing or going close towards your goal of bringing down the blood pressure or the blood sugar level? If you don't have any of those, but still you want to make your time count and make it like a short, effective walking program. If you are a beginner or intermediate level, you're walking for long hours but not get anywhere in results, then this video is for you. Welcome to Karthik Physio YouTube channel. This is Karthik, physiotherapist. How you can properly exercise your heart. Obviously, cardio we call a lot of people do as a walk, some people do as cycling, some people do as a jog. So whatever the way you prefer, this is for people how they can exercise their heart properly in a short time. The quantity of walking, that means how long and how far you walk, is that really matter? Or a short time of high intensity walking, is that matter? How to tailor them properly? A simple thing is you have to find out your target heart rate. One of the easiest way we are going to see today, it's called Karthik formula or Karthik method, which is developed in the early 1900s. So to find out your target heart rate, you need to know your resting heart rate. The resting heart rate is the one where you can see how many times your heart beats when you're resting. So the best time to check your resting heart rate is when you sit for 5 minutes or more doing nothing. That could be the best time. Or when you're waking up in the morning first time, you can check your heart rate. That will be the resting heart rate of yours. With the use of resting heart rate and your age, these two things are enough to find out your target heart rate. And with the target heart rate, the term itself answers the question, because you want to reach that rate of heart beating. That's your target. But it differs with conditions such as, if someone have a heart condition, could be anything, could be high blood pressure, or they have a heart disease, anything like that, they have to have a good consultation with a physician before they start this program. And more obviously, it's a general guideline only, so it doesn't substitute any in-person consultation with your doctor. Let's see how to calculate the Karthik formula. You can Google Karthik formula calculator, and if you scroll down all the way here, and here you see sparkpeople.com. There are a lot of websites you can actually check it, but this sounds really handy to calculate in an easier way. So all you have to do is you have to put your resting heart rate, which is right after you wake up in the morning, or if you are sitting for like 5 minutes or more resting, then whatever the pulse rate you see there, that's the one you want to put in here. Let's say if you have 70 heart rate and the age is about, let's say 45, and then if you simply click calculate, it's going to bring you, and it tells about how it works. And here if you see Here is what you're looking at. It's 55% of heart rate for a 45-year-old man, women with 70 resting heart rate. The 55% of that is 128 beats per minute, and the 85% of that is 159 beats per minute. So if somebody who is a beginner, or if they have high blood pressure or any other condition, then I would probably start with the lower range, 55 to 60% of the target heart rate. So all you have to do is you can check in your watch if you have one. If you don't have one, I would stop after 2 minutes of slow walking. Stop and check your pulse rate for 10 seconds and multiply that by 6. Then you can see where you are at. If you see, like, if you are lesser than 55% or 60%, let's say, you can increase your pace. Okay. So, but here, if you are already worked or walking for weeks or months, and then if your target rate is 85%, then you should reach at 159 beats per minute, and then sustain that 10 seconds, 15 seconds, 20 seconds, and work your way up to 2 to 3 minutes. That's a key to put your heart through proper exercise, which can strengthen your heart. So once you determine the target heart rate, if you perform this kind of walking program where you can see progress in yourself, please perform this walking 15 minutes a day, 5 days a week, at least for 3 months consistently, for you to see results such as a drop in the blood sugar level if you are a diabetic patient, and you can see changes on your high blood pressure, which can come down, and the resting heart rate even can come down. So you can prefer walking outdoors, or if you're walking in the treadmill, or if you have a smartwatch or a fitness watch, you can track your heart rate easily. But do remember, excessive fatigue, or if you feel dizzy, or if something abnormal happens when you're walking at that intensity or jogging at that intensity, you have to take a break, or you have to slow down the activity. Before start this walking program, if you are a patient of any condition, please discuss with your physician, or if you are coming out of a surgery, or if you are a heart patient or anything like that, please discuss with your physiotherapist before you start exercising. I hope this video is helpful. Please feel free to share this video if you find value on this video, and hit the like button. I'll see you in the next video. Thanks for watching. Have a good day. Bye now.